Dr. Bebat here. Let's talk about some of the equipment you may see in a doctor's office. Um, we use a lot of funny looking stuff, and sometimes it's never explained what it is or what it's for. So, we're going to start with probably the most iconic, recognizable piece of equipment you'll see in the doctor's office, and that is this. That is the stethoscope. Now, all stethoscopes are not made equal. Um, they come in a variety of qualities, and sizes, and types, and you need to have one. If you're in the medical profession, you need to have one based on your skill set and your needs. Like anything else, the use of a stethoscope is a learned process. It's a skill, and you have to learn that skill. So, what they're used for is to magnify sound. And each of the parts on the stethoscope has a use and a purpose. Most of the times, the stethoscopes are made out of PVC and steel. Now, they'll have the ear tips, which are of various different kinds. They can be soft, they can be hard, different sizes, made to fit into the ear canals and form a seal that lets you get good sound transmission. Then you have the tubes, the ear tubes, right here. And this is a single tube stethoscope. They make a dual tube stethoscope. And with a dual tube, each one of these ear tubes will have its own rubber tube. But this one, the sound is transmitted up through a single tube and then splits to go to each side of your head. This has a spring loaded in it to give you a tighter, comfortable fit. So we have the tube, it runs down to the chest piece. Now, the chest piece is probably, arguably, the most important part of the stethoscope. It is composed, there's different kinds. You can get a stethoscope that just has this flat, one-sided piece called the diaphragm. They're good for taking blood pressures, maybe some listening to lung sounds, not much. That's pretty much all I would use them for. A really good stethoscope is a dual-headed stethoscope, which has the diaphragm, which is the flat surface here, and then the bell on the backside. Mine actually has a small diaphragm over it, but a lot of times the bell will be open. What they're for. The diaphragm is very good for lung sounds. Listening to different things for bowel sounds. High-pitched, high-frequency sounds. They're transmitted very well. The bell part is good for low pitch, low frequency sounds, heart murmurs, carotid bruits, things like that. Also, due to the size, the bell's good for listening to pediatric breast sounds as well. Now, how much do these things cost? Well, you can spend next to nothing on a stethoscope, but you get what you pay for. You could probably buy a stethoscope for $10, but I'm not sure you're going to hear a whole lot. I use a Littman Cardiology 3. Littman is probably like if you're drinking a soft drink, you say, I'm going to get a Coke. Littman is the Coke of stethoscopes. I mean, pretty much. There are other brands, but I think the majority you're going to see out there is a Littman. A Littman Cardiology 3 or Cardiology 4 now, stethoscope will cost you about $200, $220. The probably best all-around stethoscope out there for general use is the Littman Classic. I think it's the Littman Classic 3 now. They run about $100, $110. And you can go on down. There's some Littmans run about $50. But if the bang for your buck is probably the Littman Classic. If you really want to hear things, if you really need to have a good transmission of sound, then you can't go wrong with the Littman Cardiology. So there's a brief little thing about one of the tools we use. I'll throw in some more at some other time when I come up with something interesting that I think you need to look at. But if you have any questions, reach out, share this, like, comment, those kind of things. I'll see you on the next one.